The Thompson and Ebstein classification of uh, posterior dislocation of hip consists of 5 different type of dislocation. Posterior dislocation. In type 1, there is dislocation with or without minor fracture. In type 2, there is a dislocation with the single large fragment of the posterior rim of the acetabulum, as you can see in the picture. In type 3, there is dislocation with the comminuted fracture of the rim with or without larger major fragment. And in type 4, there is dislocation with the fracture of acetabular floor. And in type 5, there is dislocation with fracture of femoral head. As you can see here more clearly in this picture, in type 1 there is some minor fracture, or there is no fracture. Even if there is minor fracture, then there is minor chip fracture. In type 2 there is single large fragment of the posterior acetabular wall. And in type 3 there is dislocation with the comminuted fracture of the posterior acetabular wall, as you can see in the picture. In type 4, there is dislocation with the floor through the floor of the acetabulum. And in type 5, there is dislocation with the fracture of femoral head. Thank you. That is all about Thompson and Ebstein classification of posterior hip dislocation.